Well, we have a Community Counts interview for you this morning because not only are we hoping to support our veterans at home, but also to achieve victory over violence today. Because PTSD in our veterans can often lead to violence in our communities. However, a VA accredited claims agent has a plan. So we're going to welcome Robbie Walker, who is sitting to my left, and his team, who is joining us now this morning. And of course, we thank all three of you for being here. We're going to dive right into this. Robbie, we have a lot of veterans at home who may have these concerns. So share what your program is going to do for them.
We are going to shed light on to the community, explain what PTSD is, how it can be triggered, and how we can effectively counter that with training and also benefit policies and health care. So we plan to bring a whole host of different avenues to help veterans.
Well, and Robbie, let's just touch on that. You're a veteran yourself, over 30 years in both federal and state agencies. So just talk about how, you know, as a veteran yourself, you're looking to support others who may go otherwise unseen or unheard.
This is correct. You know, it's a lifelong mission. From the time that I figured out that this is what I wanted to do in life, as you said, I have 30 years in working towards that. So this is just a different level, and that we can affect more people. And so veterans have, sometimes they're voiceless. They need somebody to speak for them, and they don't understand the process. So that's where I come in to kind of streamline things and do an assessment to try to help them with their conditions and their benefits.
Absolutely, and we thank you for your service,
Robbie.
Thank you. Alrighty, so Bishop Smith, let's turn to you. We were talking earlier before the interview. You've got over, what, 3,000 hours of mental health face-to-face sessions that you've helped people through their situations. So how do you hope to bring that to the program?
Yeah, I hope to bring a lot of psychoeducation around trauma and trauma-informed care, especially working with the military vets. I think it's over 7,000 to 9,000 vets in Champaign County alone. And we know that with the post-pandemic, military vets are one of the highest populated groups that is dealing with PTSD and trauma. But we also know that not only are the veterans, you know, struggling with PTSD, but we know that the families also are suffering in silence, what we call vicarious trauma. And so those are individuals that working with individuals that has been diagnosed or dealing with PTSD symptoms, but not only PTSD, but we also want to address major depressive disorder, suicidal ideation, and homelessness, which kind of stems, it all ties into each other around mental health and mental health education, and also just breaking through the stigma of mental health, which so many people struggle with, just breaking through the barrier. So hopefully, you know, we're looking to bring in psychoeducation and being able to help them with healthy interventions around seeking safety, to help them feel comfortable about reaching out and becoming educated around PTSD and anxiety, and as well as major depressive disorder. And so many of our vets and our community, you know, we are really pressing to curb the community violence. And I think just being able to help with the mental health portion of it around PTSD, I think is very helpful, not just for the vets, but also for the community at large.
It's going to be a win-win for everybody.
Absolutely. And we're looking to bring the services and resourcing them to the proper agencies that could help them further. And we're looking for long-term longevity with the process.
Bishop Smith, and we thank you for being in charge.
Thank you so much.
Absolutely.
Yes.
And so as we turn to you, Grace, over 25 years of strategic planning, and so just talk about, too, how you hope to contribute to this program by kind of laying out the foundations for these veterans so that they see there is a hope for them.
Absolutely. What excites me about what we're doing is we're taking this multifaceted approach. I've worked in large-scale systems, homelessness, child welfare, child care, and what you see is that the effects of untreated trauma and mental health challenges results in a lot of poor outcomes for people. And what we're doing by having a multifaceted approach, by including the families, the children, as well as linkages to services and resources, so that in addition to the training that our veterans will be getting, they will have access to other services that will help them sustain and live thriving lives. So that's what excites us about this.
And all of our veterans, at the least, deserve that chance.
Absolutely.
All right, well, before we go, we want to take a look at our screen. I want to share your contact info. This is a team, again, a team effort as we try to tackle mental health awareness with veterans. Robbie Walker, we can't thank you enough for just having this mission in place. And I know that you're still hoping for funding, so if people want to get in touch with you, you have a website and contact that you want people to reach out for you with for that funding idea. Share that right now.
Yes, the email address that I want to share, other than the one that's on the screen, is my government email, which is Robbie, R-O-B-B-I-E .walker@va.gov. So we can be reached. And I also want to mention one thing. We have another member of the team who is Nicole Massey, and she's our legal expert. So we have another vein that we can work through. I'll let Grace tell us about the website.
Yes, and you can learn more about our program by going to stoptheviolence.io. Again, that's stoptheviolence.io.